Hi, this is Dr. Vince Giardine of Ocean Integrated Wellness here in Toms River and Oakhurst, New Jersey. I'm doing this Facebook Live today because of something that happened last week with a patient that came into the office. It made me think all weekend about whether or not I wanted to do this, and I thought that this is something really important that people should know about. So let me tell you a little bit about the patient. They came in about a week ago and asked me if I could help them because they were having some neck issues, pain down the arm, and their hand was going numb pretty regularly. They also told me that they had just had an MRI. So I said, well, if you can bring the MRI in, we can take a look at it for you, and then I can go over it and discuss with you a possible treatment plan. So they came in a few days later and brought their MRI, and I took a look at it. It was a cervical MRI in their neck, and saw something that concerned me. So I asked a couple of questions, and when I got the answer, I knew right away that this lady was in trouble because there was nothing I was going to be able to do to help her. And I thought about that because what ended up happening is that when I saw the MRI, I asked the lady if she had had any surgery recently over the last few years or so, and she said yes, she had some similar pain before. And she went to her doctor. Her doctor sent her to an orthopedic surgeon, and the surgeon suggested, of course, the way we can fix this is surgery. And she decided, well, sure, that's what everybody does. Let's go ahead and get the surgery done. That way I'll be free of pain for the rest of my life. Well, unfortunately, as many times, it didn't work out for her that way. And now she's in pain, as bad as before. And basically the surgeons are telling her there's nothing they can do at this point anymore. And there's nothing I can do because of what took place there. So what I want to do here for a moment is I want to go over a couple of MRIs with you. I want you to see a normal one, and then I want you to see this patient's MRI, so that you can see the difference between what normal is and what happens when surgeries don't go the right way. So over here on this left side, this is what we would consider a normal MRI. What you're looking at, this of course is the front. You can see the nose and the mouth, and this is the back. Each one of these rectangles here is a vertebra, and the space between them, that little pillow that you see between each one, is the disc. You can't see these in x-rays because x-rays are really only for bony structures, but they come very clearly in MRIs. And so what we also see is as we start going toward the back, this is a canal right here. This canal is where the spinal cord runs down. And you can see, of course, here's the brain, the back of the brain, the lower part of it right here. And this gray strip going down is the spinal cord, the nerves, the actual nerves. Now you don't see all of them because the way an MRI works, it takes pictures in slices. So some of them, there's more than what you see here, but you can't see all of them at one given time as you work your way through the MRI. But I wanted to show you this picture anyway because it's a good illustration. What we're looking at here is we're looking at the back line, that you see that dark line that's going down behind the vertebra. That line should be nice and clean, just like this. What that represents is if for some reason you're having a disc problem, that disc could bulge past that line and press on one of the nerves in your spinal cord, giving you some of these symptoms that this patient had. You could have tingling in the arm, you could have neck pain, you could have tingling or numbness in your hand, your fingers, depending upon where that disc is pressing on these nerves. So in this case, it's a very nice and clean spine. There's really no problems. Maybe just a tiny, you see that little tiny bulge right there, but it's very, very minor and would probably not cause any particular problems. But if someone came to me and said I had numbness and tingling, I might suspect something right there. But other than that, it's a very clean scan, and the person looks good. The reason you see the different colors, the white and the gray, is because the MRI, when it hits liquid or water, it shows it up as white. And as you know, the spinal cord is inside of a fluid, a cerebral spinal fluid, and that's mostly made up of water, and that's why it comes out white. So in this case, you can see back here the muscles that are back here. Everything looks pretty clean, and chances are this person's not having any particular symptoms. So if we move to the right, you see the MRI of this patient that came in. And of course, you can immediately see the difference between the two. And this is unfortunately, there's no better way to say it, but this is a mess. The fusion took place there. As you can see, there was also some work done in here. And what we're really troubled by is the fact that now this part of the neck is pushing so far back into the canal. Unfortunately, because this is already fused, there really is nothing more we can do for it, and she is suffering greatly because of this. So after we talked for a few minutes, she of course was very upset and angered in many ways that she decided to have the surgery, when now there's so many ways that we can help a bulging disc without having to go through something like this. And this is what I wanted to show, that not to say there may not be times when something is so severe that the only way to fix it or to intervene is through surgery. But what I'm saying is that the vast majority of times, surgery is not necessary. And we run to surgeons because we think that's the only way to fix things. So what I ask you is, I'm going to ask you a couple of silly questions. If you had, if this finger was in pain and the surgeon said, well, we'll just cut the finger off, and that way the pain would go away. Of course, you would never go back to that surgeon. If your leg was in pain and they said, well, we'll just amputate the leg and that will, we'll get rid of it that way. Obviously, you wouldn't go for that either. So why are we so quick to say yes about somebody going in and doing work inside of our spine, which is such an important part of our body, that if it doesn't work correctly, there's nothing anyone can do anymore. There's no way to fix that anymore. Even the surgeons would tell you, I'm sorry. I mean, they can go back in and try, but typically the more you go in, the worse things become. To give you another example, I had a patient that was in, he was having some low back pain, and after about one visit, he disappeared. But he came back about 2 weeks, 3 weeks later. And he came back to show me that he had gone to his surgeon because there was a bulge in one of the lower discs in the lumbars. And the surgeon says, well, this is the same thing that had happened to him before, earlier this year actually. And the surgeon said, well, we'll just go in there and we'll snip it off again. So he was happy, he felt a little better, pain was a little bit relieved. But the surgeon said, well, of course this can occur again, and if it does, we can just go back in and do this again. So I didn't say anything to him at that point, but my point to you is, why does it keep happening? Because what we're doing by going in there and snipping is we're fixing the symptoms, but we're not fixing the problem. And the reason discs bulge is there are very specific reasons for this that can be dealt with very easily. We have tables today that are called decompression tables. We have physical therapy. We have all different things that we can do that could make a big difference in how you feel and eliminate many of these problems without having to go in such a drastic measure and start cutting and fusing. I've had patients come in that were in a lot of pain that had laminectomies. What is a laminectomy? Well, laminectomy is when they actually go in and they cut pieces of these bone right off, so that they say that by taking this bone away, it relieves the pressure in the spine. Well, what happens when the pressure comes back and that person is still in pain? You can't keep cutting bone off. At some point, there's not going to be there'll be no structure there for the person to be able to even stand. So what they tell the patient is, I'm sorry, we did all we can do with this. You just have to put up with the pain. And they try to get them on some type of opiate medication, which of course is another whole set of problems, because people become addicted to these things. So I could sit here and tell you story after story after story of people who have, I had another lady in here, just to tell you one more story because I think it's significant and important. When I looked at her original x-ray, she was having some pain. Her x-ray was about 10 years ago. It actually looked pretty good. There was a couple little bulges there, but it wasn't bad. So the doctor said to her, well, in order to fix this, we're going to have to go in and we're going to have to do surgery. And maybe as another video, I'll show you those x-rays. Well, they went in, they did surgery, they put in some screws, they put in some metal, they bolted it all up, and they made it look like she was a bionic woman there for a minute. So she had slight relief for a short while, and then the pain came back. So she went back to the doctor and he said, well, what we'll do is we'll do some nerve burning. What that means is they go in and actually try to find the nerve that's giving you problems, and they do something to it to deaden it. Unfortunately, that didn't work either. So now she has some dead nerves. She still has pain. She has bolts. She has screws. She has metal. And she went back and said, well, is there anything? I'm still in pain. What can I do? They said, well, what we'll do is we'll put in, I'm sure many of you have heard of a TENS unit, a little electrical stim unit that sometimes you put on your back or your low back or your upper back. It has pads, and you adjust the type of frequency that it's there to help with the pain. Well, they have implantable ones where they can actually put the stim unit inside you and then run the wires to wherever it is they want to run the wires. So they did this with her. They brought her in, they implanted the stim unit, and they ran the wires, and 6 or 8 months later she was still in as much pain as she was before she started all of this. She came to us. When I saw the x-rays, I said to her, there's not a whole lot we can do because you've already been operated. You've been fused, you've been bolted, you've been screwed, you've been, you've been burned, your nerves have been deadened, you've had a implantable TENS unit put in there. There's not a whole lot I can do for that area because of the way that area now is. And we tried a few things. We did some physical therapy with her and a few other things, which did help slightly, but unfortunately there was not much we can do for her. So the point of this video is, I'm not here to say that surgery is never a necessity, but what I am here to say is that why make that your first choice when there's so many other things you can do that could work and make you better without the dangers of something like this happening. We can help you. There's many different options today for someone who's having low back pain, neck pain, if you're having numbness, if you're having tingling. There's so many good options that are painless, that are effective long-term. Most of the patients, if not all, I'd say 95 to 98% of the patients that we help, we don't see sometimes for years. And if they do come back, many times it's for something completely different. But they know we helped them with their original problem, and they know that we can help them with their new problem. So if you have an MRI, if you are having a problem right now, if you're having some neck pain, some numbness, some tingling, a neuropathy, whatever the problem may be, if you think surgery is an option, I'm asking you to give us a shot first. Give us a call. Come on in, bring your MRIs, bring your x-rays, let us take a look. Because I would say 9 out of 10 times, there are things that we can do, there are services we can provide you that can save you from surgery. At the very worst, which happens very rarely with us, but at the very worst, if nothing we did helped, you could always go back to surgery. But doesn't it make sense to try the least invasive things first? Like I said, if you walk into your dentist because the tooth is hurting, you don't let them start pulling your teeth out because you have a pain in your teeth. So think of this in the same way as far as your neck and your spine and your back goes. There's a lot that goes on there. There's a lot that can be done. And we'd be more than happy to help you. If you have any interest in finding out about these other methods, these other ways that we can help you, give us a call. You can contact us through Facebook. You can look up our website at oceanintegratedwellness.com. And we're more than happy to work with you and to help you to feel better. Thank you.